Now, if hospital, an A&E, maternity ward or another specialist health service near you is being lined up for the chop, you'd want to know about it. Well, there are claims that health bosses across England are making plans to save money by closing NHS units, and they're trying to keep it a secret. The group, the King's Fund, says patients and others are not being consulted about the plans. Our health correspondent Catherine Jones has more.
With the money it's given, our health service simply can't keep up with the demands upon it. So over the last year, major plans have been drawn up to revolutionise the way healthcare is delivered across England. The basic aim of these plans is a good one: prevent people becoming sick and treat them closer to home when they are. But of course, there is also a massive pressure for these proposals to cut costs. And that means the axe is going to have to fall somewhere. This hospital in South London, for example, is one that is slated for possible closure. And it's the way these decisions are being made, shrouded in secrecy, that is causing such alarm.
I think we should know more. I think they're trying to pull the wool over our eyes a little bit.
We are the ones that use the service, you know. It's not for someone in a suit to decide.
Joe Public should know what's going on. Joe Public pays for the National Health Service.
The campaign group fighting to save St Helier Hospital say their efforts to shine a light on the process haven't been welcomed.
By the time the public realise, it could well be too late to stop this. When the public do find out, I think they'll be furious, but it's death by 1,000 cuts so far.
As well as a hospital closure for South London, where else might the axe fall? Well, in Birmingham, the merger of the city's women's and children's hospitals is mooted. In the northeast, Teesside looks likely to lose an emergency department, and at least one A&E in the Cheshire and Merseyside region will be downgraded to a minor injuries unit. But little more is known, as NHS England has insisted local managers keep plans secret until they've been centrally vetted. NHS England has now said it'll allow extra time for public consultation, but the body that champions patients' rights, Healthwatch England, fears this secrecy row may put people off.
What must happen is that people stay open on both sides, that the public feels able and welcome to have its say, and that NHS managers and all those people who are doing this thinking about what is essentially the biggest set of changes to our health service, that they stay open and willing to listen.
The 44 plans covering all parts of England will be published in the coming weeks, and public consultation will begin in the new year. Only then will it become clear just how much of the NHS's new direction is actually negotiable. Catherine Jones, 5 News.